Today I'm going to be talking about receiving constructive criticism as a registered nurse. If you're looking to improve your nursing skills, please consider subscribing down below. I'll be uploading an educational video every single Wednesday and a special video every Sunday. In the nursing field, we always are striving to provide the best patient care we can. But are we actually doing our best? What if there are ways that we can improve? Well, to be frank, there are always better ways you can be doing something. And as a new nurse like myself, I'm always open to hearing constructive feedback from senior nurses, educators, or from my manager. Being open to receiving feedback is so important for building your skills and helping patients. And the first step in doing that is to making sure that you're able to vocalize to the senior nurses that you're open to hearing feedback. You know, in this day and age, a lot of senior nurses don't want to spend time. They've had preceptor students, they've had students, they've done teaching, they've taught so many nurses, and you know they're tired. But if you're a registered nurse and you're working with a senior nurse and you look for them to give you knowledge on how to better your practice, they're always willing to help you. And in my experience as a new nurse, the best ways that I've learned to improve my practice is to hear from the more experienced nurses on that floor. And a lot of times it just requires you to tell them, hey, I'm looking to better my practice. If there are ways that you know how to draw this medication up, to administer this medication, if there are acronyms, if there are ways that you learn that you can teach me to improve my practice, please be sure to tell me. I'm always open to hearing that. And that requires you to for sure vocalize that. However, I do think it's worth mentioning that you shouldn't be able to take feedback that's very negative constantly. A senior nurse should never be able to speak poorly in front of patients towards you or make fun of you or say negative things. Rather, I'm talking about giving you constructive criticism on ways you can improve your practice in a setting that's appropriate. So I believe that every nurse has the ability to improve their practice, whether that's a senior nurse or a new nurse. And the reason why I think that is because every patient is so complex that comes in. There's so many comorbidities that vary each and every single time with each patient that it's almost impossible for a nurse to know everything, for a physician to know everything, for a pharmacist, for a physiotherapist, for an occupational therapist to know all the resources, all the forms of care, all the medications. So everyone should be able to be open to hearing constructive criticism. A good example is if a patient comes in with heart failure and they have with heart failure and they come up to the unit and you notice a wound and you provide treatment for that wound by putting, for example, iodine and a mepilex, for example, and you notice that the wound care nurse comes in and tells you, hey, that's actually not the best way to treat this wound. The best way is to provide this AMD or put a MEPOR, and that will prevent its growth, or to have it open to air. These are practices that require clinical judgment that a wound care nurse may have, but you as a registered nurse don't necessarily have. So as a nurse, you're always looking for improving your practice and being open to hearing the wound care nurse's clinical reasoning and judgment for putting a MEPOR on that wound or having it open to air instead of having the treatments you provided, and asking that person, you know, being open to hearing that feedback. Hey, I was just wondering, why did you put a MEPOR or have that wound open to air rather than putting iodine and putting a mepilex border over it? I would love to hear your rationale behind that. And asking questions like this will definitely improve your practice because you're able to understand the rationale and reasoning for different interventions. So that's why I really wanted to make this video. I think constructive criticism is extremely powerful to nurses in improving their practice. And as a nurse, that's what you ultimately want to do. You want to provide better patient care, better patient outcomes, and ultimately feel better about what you're doing. And the best way to do that is to have other nurses share their knowledge with you so that you're able to provide the best and most time-efficient interventions. I hope you guys enjoyed this video. Please give it a thumbs up if you did. Leave me a comment down below. Have you ever heard constructive criticism? Is that something that was on your mind at all when you were practicing as a nurse? And please be sure to subscribe down below. Like I said, I'll be uploading a video every Wednesday and Sunday. Thank you and take care.